Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prassad, with my background in pediatrics, emergency medicine, urgent care, and affiliated with St. Joe, Oakland, Henry Ford, and Beaumont. Today, the theme of my health talk, today I'm going to talk about what are the issues like major behavioral issues that are facing our children and adolescents. We'd like to know the fact that in spite of so many measures are being done to improve the children's behavior, to reduce rest, psychiatric upset, and all that, still a lot of kids are still affected with the behavioral disorder these days. So the American Psychiatric Association, what is the definition of behavioral disorder? Any persistent and repetitive pattern of behavior that violates the social norm or rules, seriously impairs a person's function or creates distress in others. The term is used in a very general sense to cover a wide range of disorders and the syndrome, also called the behavioral disorder, and this is cited from American Psychiatric Association, APA 2013. So it can be caused by any of these or the combination, such as the precipitating factors are social, genetics, environmental, or developmental. Next slide, please. So there are some of the behavioral disorders that I have classified, starting from the simple ones to go down below to the more pathological one. Attention deficit disorder, which is characterized by inattention and hyperactive behavior and strong impulsive behaviors. Lack of attention and impulsive behavior, difficulty focusing and thinking about what they are going to talk about. Bullying is very common in young age group. These are the aggressive behavior with the power imbalance, and that can lead to emotional distress. Anxiety and depression, as we are going down, persistent worry, sadness, loss of interest in duty. Autism spectrum disorder. So many work has been done on this issue. This is a developmental condition that affects the social interaction and communication. Substance abuse and addiction, excess use of drugs, alcohol, and smoking. Substance abuse, addiction, okay. And then recently they have come up with a new disorder which is called opposition defiant disorder, which is a persistent pattern of angry, augmenting, and defiant behavior. So those are the main. Third slide, please. Public health crisis. Behavioral disorder can be associated with poor academic performance, failing grades, diminished psychosocial function, increased emotional strain on the caregivers concerning what do they do. This includes self-injury, suicidal ideation, physical and verbal aggression, and substance abuse. That includes alcohol, drugs, and smoking. So this is all a public health crisis. What are the clinical manifestation of anxiety disorder? Symptoms of anxiety disorder, they can manifest in any way. It could be physical, emotional, or behavior. The physical symptoms, the physical manifestations include shortness of breath, chest pain, shaking, sweating, nausea, vomiting. Psychological symptoms include a repetitive and intensive thoughts, compulsive behavior aimed at reducing anxiety, and low self-esteem. So these are the major. A newly recognized condition is disruptive behavior that I mentioned before, and this can be detected by DSM-5 even at the doctors, at the pediatricians or any physician's office. They have become like a normal routine test besides all the other tests that are being done for this purpose. Next slide, please. So environmental factor, very important. The environmental factor include at home or outside. A domestic violence or family conflict plays a significant role. Poverty, financial insecurity, substance abuse, parental neglect. Poor parental guidance and supervision plays a very important role in causing symptoms manifestation in this kids. Social environment factor include an exposure to a toxic home situation, like I said before, domestic violence, alcohol, drug abuse, e-cigarette use, excess social media and consumption by the parents and the children, which is very important. So now, brain pathology, I just want to say a few words about the brain pathology, how these neurons work. The neurotransmitter dysregulation, there is an imbalance in the dopamine, norepinephrine, and serotonin. These are the chemicals, they play a critical role for mood regulation and impulse control. Genetic variant, increased likely such as family history of somebody with an schizophrenia, bipolar disorder, and major depressive disorder, if there is a family history. Social and psychological factor, chronic stress and trauma disrupt the normal brain function, contributing to the emotional dysregulation. Next slide, please. Here is a diagram of the brain that explains you. The front is the precentral lobe. This is the areas of the cerebrum that controls the thoughts, activities that somebody is going through. Amygdala is a small area in the base of the brain, and then there is a hypothalamus. The abnormal behaviors, they start in this amygdala area. It controls the emotional response, especially for aggression and anxiety. The hippocampus area is involved with the memory function and self-regulation. Orbitofrontal cortex, responsible for decision-making, planning, and regulating the impulsive behavior. Next slide, please. Chemical imbalance in the brain plays a crucial role in the development of behavioral disorder. the key symptoms. What are the key symptoms for chemical imbalance? Includes chronic fatigue, persistent pain, sleep deprivation, insomnia, frequent mood swing, and emotional instability. A difficulty making decisions and maintain your focus. Next slide, please. So, in other words, what is behavioral issue and in adolescent? I have summarized all this in a brief form, and I will add to that to my note. And the thing is, I have gone through a lot of references, and the references are there. And I went through all these references in order to, when I was preparing my manuscript, and then I like to thank our viewers for watching this. Some of the interventional program include, next slide, please. Meditation play a very significant role. Proper diet, exercise daily, daily try to concentrate, stay focused what you are going to do, and that plays a significant role. How you are going to face yourself. So the treatment regime for behavioral disorder includes interventional program, early identification, personalized behavioral therapy, medication management, use antidepressant, stimulant, mood stabilizer. However, those should be done under clinical supervision. Psychosocial support, very important. Family counseling and a group therapy plays a significant role to address the interpersonal conflict, mindfulness, and meditation. So these are the techniques that reduce stress, enhance focus, and regulate our emotion. So in summary, I have briefly summarized about what could be the causes of behavioral disorder in our adolescent, young children, and adolescent, and also the adults. And I have provided with the references that they can look at. I'd like to thank our viewers for watching me today on my podcast about the behavioral disorder. I'd like to thank our producer, and also I'd like to thank our helper who helped me in organizing all these slides presentation. Until I see you again, you have a wonderful winter and upcoming spring. Thank you again.